Doing a parasite Q&A today, and I'm really happy to answer a bunch of questions that came into our website. But also, if you're joining in live, make sure to type your questions in the question box, and if there's time, I will get to them. And also, if you're listening to the replay of this video, make sure to type your questions in because our team will answer your questions. And we have a lot of questions that come in about how to treat parasites that are causing chronic disease. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis 35 years ago, and I thought I was a really healthy person. I was 28 years old, I'd never been sick, had 2 young children, I was a young mom, and I went from being a really healthy person to all of a sudden being diagnosed with this incurable, mysterious disease called multiple sclerosis. And I was devastated. I was told that I would be in a wheelchair, that there was nothing I could do. I would become completely disabled in time. It's important to share this because this is a story for many people. Many people, we've had little warning signs of, maybe we just thought it was aging. We didn't realize that what we were dealing with was parasites. We were dealing with the early warning signs of parasites. And so there is this growing awareness of parasites. People are becoming interested, and they're not buying into this autoimmune chronic disease, got to live with it, got to stay on these immunosuppressive drugs forever. And they're starting to question whether parasites could be causing the symptoms and the diseases that they're dealing with. If you do suffer from multiple sclerosis and you didn't listen or watch my live event that I did last week, make sure to check it out. You'll find it on our website, livediseasefree.com. And I answered, I gave you a lot of evidence as to why I believe multiple sclerosis is caused by a parasitic infestation. So I'm going to head over to some questions. Again, you can go ahead and type your questions in the question box. And if there's time, I will still answer additional questions. So the first question that I wanted to answer that came into our website is, where can I get tested for parasites? So in order to be tested for parasites, it's very difficult. Our very best tests right now, they will identify, find maybe 10% of the parasites that we're dealing with. So that is definitely a problem. Whether it's a stool test that our doctors can perform, whether it's a comprehensive stool analysis, whether it's a DNA test, whether they're looking at our urine, our stool, our blood, and they're looking for parasites. So whatever the case is, the very best test that we have right now would be picking up about 10% of the parasites that we have. So this is a really big dilemma. If you can get your doctor to do a stool test, and it's not going to cost you anything, that's totally fine. But if you have to pay for it, if you have to pay $500 to $1,000 and the test is not going to identify the parasites you're dealing with, it's really a waste of money. So what we have done, what our students have done is that we are, instead of trying to figure out which parasites we have, we are looking to see which treatments test the best for us. And so we do this through energy testing. So we can go to a practitioner. It could be a naturopathic physician. It could be a chiropractor. It could be a functional medicine doctor, nurse practitioner, acupuncturist, some kind of a health professional that has some training in energy testing. And if you don't know what energy testing is, every living being, like whether it's an animal or plant or human, it has this energy field around it. And there are certain things that will change our energy field. So toxins and parasites can decrease the energy around us. So they can pick this up with advanced muscle testing. They can pick it up with different little machines. There could be Vega testing, AMA, and ART testing would be more of like an advanced muscle testing. So again, there's a lot of different types of energy testing that they will rely on. And it's not an exact science. There is room for bias. That's why it's ideal if the practitioner is blind and they don't know what they're testing. That would be really helpful because some of the biases will be removed. But it's quite cost effective, and it's another piece of information that we can use to help us figure out which treatments we need. And so if we are, let's say, just one sec here, if we energy test well for, let's say, 3 parasite drugs that treat roundworms, then we probably have roundworms. If we energy test well for different parasite drugs that treat protozoa, then we probably are dealing with a protist infection. If we test well for parasite drugs that treat tapeworms or flukes, then we would probably have those types of parasites also. So again, it's instead of trying to figure out which parasite we have, we're looking to see which treatment tests well for us, and that gives us clues as to which parasites we're dealing with. So that can be really helpful. And the way that we determine the game plan of treatment is really through looking at our health history, looking at the health history of our parents, looking at our diagnosis, our symptoms, and our energy test results. And those 5 criteria brought together, they help us to determine which parasite drugs our practitioners should prescribe for us. So the next question is, I tested negatively for the parasites in my stool, but based on what I've learned from you, Pam, now I know that I'm infested. So what do I do now? So this is where, if you've had the stool test done and they haven't found anything, then what I would do is I would look for somebody who does energy testing. As I mentioned, that would be more helpful. And it's ridiculous that it is so challenging to treat parasites in this day and age, because we've known about parasites for many, like I would say 150, 200 years, maybe even longer, but it's a lost skill. It's a skill that many of our practitioners would have had. Maybe they used just a small number of drugs many years ago and maybe herbs, and now it's something that they have been taught that we cannot have parasites if we live in a developed country unless we travel, and nothing could be further from the truth. Third question, how can I find a doctor who will support me so that I can treat parasites? So this is a really big dilemma that a lot of people find themselves in. And so what I would say is that you can't convince a practitioner to help you. You could always ask, but if they are not open to it, then I would move on to another one. I think that you'll have more success with doctors or practitioners like integrative practitioners in some, or maybe I know one state, but also in one province. Naturopathic physicians are allowed to write prescriptions for parasite drugs. So in most places, naturopaths cannot, but in some states and a province, they can. So I know in Arizona, naturopaths can write prescriptions, and I know in British Columbia, Canada, they can also write prescriptions to treat parasites. So those kind of doctors could be helpful. What I would do is I would really just look for integrative medical doctors that can write prescriptions, because it is really helpful to incorporate the parasite drugs with the herbs and with the oxygen therapies. Layering the treatments is really, really helpful. So what I personally would do is I would look in a bigger center, a city that's close to me, and I would look for, a naturopath, because I'm in British Columbia, Canada, so we could find somebody to write prescriptions here. So I would look for a naturopath that is kind of like, I would say that maybe they treat Lyme disease, maybe they are just more into, helping heal the gut, integrative practitioner. And you can simply just email their office and ask them, say, I really believe I'm dealing with parasites. Would this doctor be able to help me? Would he be willing to? And they'll let you know. So I would look for an integrated practitioner. You could have a general practitioner, like sometimes in certain countries, your general practitioner would like to help you also, and that would be fine. It's just that they don't have a lot of skill. They don't really know how to treat parasites. They haven't been trained in how to treat parasites. And so that is a real dilemma. That is something that is going to come. So with my students, they have to literally play an active role in having their practitioner to treat parasites, because if your practitioner doesn't know how to treat parasites and they start to, prescribe really low doses for 1 or 2 days, it's really not going to do anything. It's not going to really treat the parasites well. So you need to know the more effective protocols, and then you need to, respectfully direct and work together as a team with your practitioner. So you'll have to look around. You'll have to look around in your city, in your state. There's a lot of doctors that do telemedicine now too, so that can be helpful. So just look for practitioners that would be treating different types of, maybe candida or Lyme disease, and then they would probably be more open to treating other types of parasites also. What antiparasitics do I recommend? And why can't you tell me what treatments to use? So, well, number one, I'm not a medically trained healthcare professional, so I definitely cannot give medical advice. I'm an educator, and the problem is that in order to determine which treatments you use, you have to know basically what types of parasites you're dealing with. And that's why the energy testing is helpful, because if you take, let's say, a parasite drug to treat tapeworms, but you don't have tapeworms, you're not going to notice any benefit. And all the parasite drugs, they are toxic. They all have an LD50 rating, just like Tylenol. Any medical drug has an LD50. So they're all toxic. So you don't want to take something if you don't need to take it. So I can tell you names of parasite drugs. So there's albendazole. There's a whole group of drugs that end with like azole at the end. So azoles, they're called. So there's albendazole, there's mebendazole, there's thiabendazole, there's levomizole. There's a whole bunch of different drugs that end with that have the same ending of the drug. And they are more for roundworms, but some of them will treat tapeworms. So albendazole will treat certain tapeworms. Albendazole will cross a blood-brain barrier. Mebendazole would be a safer roundworm medication for, let's say, if you have children that need to be dewormed, or parental palmawate. Those two just work more in the gut. They're not going to work more systemically. And so these are things you have to consider too. And that's why we look at your diagnosis and your symptoms and your health history, because if the parasites have moved into the central nervous system, then it would be helpful to use treatments that cross the blood-brain barrier. Otherwise, you're not going to have you're not going to have the killing effect where the parasites are, or where some of them are. The biggest area, or I should say the biggest concentration of the parasites, would be in the gut, would be in the intestines. And so I should also mention too that with other parasite drugs, so there's praziquantel, which would treat more of the flukes, and flukes are really common, a lot more common than people realize. So praziquantel is a pretty commonly prescribed drug if people have tapeworms or flukes. And then parental palmawate is, again, similar to mebendazole, but it also can be helpful. And there's tinidazole, which is more for if you have smaller parasites like protus, and also Alinea, which is nitazoxanide, which is more of a broad spectrum antiparasitic drug, which will be, it will treat different types of parasites, and it even has antifungal properties. So it's quite a favorite with some doctors, but it's not going to be the end-all be-all cure for all parasites. That's the dilemma that we have. So with our students that have chronic disease, they usually test well for 3 to 5 parasite drugs at one time. So they don't start with all 3 to 5, because that would be pretty hard on them. But it's not just a one pill cure. We have not seen that in working with hundreds and hundreds of students. Really what it boils down to is that you have small intestine and large intestine. And a lot of the parasites like to live in the small intestine. And so we can do the oxidizing enemas, where we can release some of the parasites from the large intestine, but we can't reach the small intestine with the oxidizing enemas. So we have to use parasite drugs and herbs to kind of move them down. The dosages that we're using don't necessarily kill all the parasites, but they definitely move away from the medication, and sometimes they will move into the large intestine where we can treat them or hit them easier with oxidizing enema. So when I tell you the names of these drugs, our students usually test well for 3 to 5 parasite drugs, and they also test well for antifungal drugs. And whether it's diflucan, which is fluconazole, or Sporanox, which is itraconazole, or nystatin. And if you use nystatin, make sure it's not the liquid, it has sugar in it. It would be tablets or capsules. So I cannot say any dosages, or I cannot give protocols, because that would be very irresponsible. I don't want to hurt anyone, but this is for educational purposes. These are some of the names you can talk to your practitioners. You can get energy tested on them. But again, it's not just the energy testing, because there are some practitioners that are really good at energy testing, and there's some that might not give you the right information. So this is where we have to look at your symptoms, your health history, the health history of your parents, your diagnosis, and the energy test results. And if the energy test results are consistent or agree with all of the other 4 criteria, it's just more evidence that you're understanding what you need to take. But if it's completely like, I've had a practitioner with one of our students say, you don't test well for any of the parasite drugs, but I can pick up that you have parasites. And then it's kind of like, okay, next, right? Because that doesn't even make any sense. So we have to use common sense. We have to use logic also with it, because like, even if we had a good parasite test, unfortunately, it's going to take a long, long time for that to happen, because there are literally hundreds of parasites that can make us sick. There are so many different types of bacteria, so many different types of protists and fungi and worms. And for them to, like, if we were focused on this, it would definitely help, but they're not focused on improving the tests. And then another problem is when they're doing a DNA test, they're taking a tiny, tiny, minute sample for testing. And if it doesn't have the DNA of the particular parasites that you're dealing with in that tiny, tiny little sample, it's not going to show. So that's why the parasite tests are not helpful. And I don't know in our lifetime if we are really going to have, I think that we could, if they could sequence enough of the, so I guess every parasite has like a unique section of genetic material. And if they could really start to catalog that, and then if they could use AI to sift through all that information, and when you have a test to find exactly the correct match, it could be done. But there's just no money in treating parasites, and there's just not a huge incentive in this area, which is really unfortunate, because this is the area that could really save tax dollars, save our healthcare systems, because if we treated parasites early, we would avoid a lot of chronic disease. We wouldn't have chronic disease because we could treat the parasites early before we end up with such an infestation that we have chronic diseases. I will come to your questions in a moment there. A couple more here that I need to cover. Can parasites also cause dementia, Alzheimer's, fibromyalgia, interstitial cystitis, diverticulosis, diverticulitis? Yes. Parasites can cause virtually any condition, any symptom, and any disease. So when we have symptoms and we have disease, it can be from nutritional deficiencies, which for most of us, we don't have that because we live in countries where we have ample nutrition. But it could be from nutritional deficiencies. It could be from toxins in our environment. And most of us don't live in a radioactive environment or a lot of heavy metals. It could happen, but it's not the norm. Or from parasites. So again, nutritional deficiencies, toxins from our environment, and the parasites. Those would be the 3 causes of disease. And so for most people, parasites are causing all of these neurological diseases, all the autoimmune diseases and cardiovascular diseases, cancer. I've done so many events. Check out our website, livediseasefree.com. Go to our blog, and just start looking back on the titles and picking topics that you'd like to look at, because I've covered a lot of this information in my different live events. You'll find them really helpful. It'll give you a lot of clarity. People are thanking me all the time for all the work I've done. This is my gift to you. This is my gift to the practitioners also. So last week, if you do have multiple sclerosis, last week I talked about the reasons why I believe parasites cause MS. And a parasite can be worms, it can be bacteria, fungi, and protists. So it can be any microbe that lives in your body and causes you harm. And so that is something, that blog post, that event, you can share with your practitioner if you want them to start understanding and seeing the huge mountain of evidence that we're dealing with parasites. And the nice thing is it's all research-based. It's not my personal opinion. I mean, other than anecdotal recoveries of our students that have followed the plan, treated parasites, and have recovered, but it really has a lot to do with the science, and that's what they want to see. So I've put that together for you, and I will be adding to it. One thing I realized I didn't add, and there's probably other topics, but we know in science that parasites cause lesions in the central nervous system. It's well documented in science. So that's another piece of evidence. And what do we have when we multiple sclerosis? We've got lesions in our central nervous system. All right. So yes, parasites can cause any disease and they are involved, but it's not just going to be one parasite that causes Alzheimer's disease and a different parasite that causes ALS. Because when we've worked with different students with different diseases like that, sometimes we're using some of the same parasite drugs and sometimes we're using different parasite drugs. So there's overlap for sure, but they're not always all the same parasites that we're dealing with different chronic diseases. After successfully treating parasites, can I go back to a normal diet? Well, it depends what you call a normal diet. Once you have suffered with a parasitic infestation and you've gotten really sick and you've had chronic disease, you don't ever want to go back to that. So remember that a high carbohydrate diet will really promote the bad microbes in our body. So yes, we can have more carbs once we're well for long enough. And if your microbes are in balance, you won't notice anything negative if you eat a little bit of extra carbs. You will just find that you just feel normal. You feel really good. But if you eat extra carbs and then you notice that you don't feel well, and it could be even like a little bit of brown rice or quinoa or a little extra fruit, and you notice some symptoms coming back, it just means that you have more work to do. So it's not that carbs are bad and carbs don't cause health problems unless you're eating a ton of processed carbs. But if you're eating healthy, whole grain, eventually, once you're well, it's totally fine. And yes, you can go back to not a normal diet, because I think that when we get sick, a lot of us have had poor diet habits and we want to improve on that. But you'll find what works for you and you'll definitely be able to incorporate more carbs again. The low carb diet is just really important for getting ready to treat and treating. It really helps tremendously. So after recovery, how can I prevent reinfection? Live in a bubble? No. So what you can do is there are certain things in our life. So like we have a lot of animals around us, right? And animals are notorious for eating disgusting things in the dirt. They are probably exposed to a little bit more parasites than we would be for sure, unless you're working in the dirt all the time. So definitely washing your hands. I wear gloves outside when I'm working with the animals, and I still wash my hands. I have a little, those little brush. It's like a little brush, and it's long and narrow like that, and it has bristles like that. And I scrub underneath my fingernails. And the rule of like counting to 20, lots of soap. Sometimes I usually wash twice. What we've done with our dogs, we used to have breeds that we had in the house, and now where we live, the breeds that we have, they love to be outside. So I'm so grateful that I love dogs so much, but I'm really thankful that I don't have hair in the house. But I would really recommend, if you do have pets in the house, don't let them sleep in your bed, because that's really an intimate way you can get parasites from them. I would definitely not do that. If you have a yard, and you have especially children, I would make sure to section off an area where they're going to put their waste, where they're going to pee and poop. I would make sure to have an area sectioned off so they're not going in the area where your kids would be. And that way you're really separating out the pairs, and clean it up like daily. Pick up everything. Like I have a horse, and I could just leave the feces just build up everywhere, but I keep it under control. I pick it up at least once a day because I don't want to be spreading parasites around. So we deworm them. We really keep all that matter contained in an area, compost it, and then spread it out once it's composted and heated. So just using really wise practices, really important. Even like if you have, animals on a pasture, right? If the pasture is not like acres and acres and acres, and if you can clean up their poop, that's really important. Keeping so that it's not infecting your soil. That is a really big part of management of parasites. So again, in your home, if you do have dogs that go outside and cats that go outside and they come back in, and they're going to step in their poop, their feces for sure, unfortunately, very often. So, keeping your floor clean, washing it regularly, and ideally, especially with cats, from the doctors I've studied under, they carry a lot of diseases. So be really careful with a cat litter box, and just know that they do carry a lot of diseases. And doctors that I've studied under have said they really recommend not having cats in the house. But I know that they're part of our family. So this is where you just become aware, and you just start to really have good practices. So cleaning the kitty litter box regularly, like often, using gloves, disinfect, washing the floor. It's just a little bit more work, but it's all really important. And then we are going to be exposed to parasites. Like, they're part of life. Like, we want to enjoy life. We want to enjoy our animals. We want to be outside. We want to be gardening. We want to be eating produce from different countries that come in. So it's very important that we treat parasites at least once a year, possibly twice a year. So if you feel really good, if you've treated and you have high energy and you're sleeping well and your cognitive function is clear, your mood is good, no allergies, you just feel good, you can skip up the stairs, that means you're in balance quite well. That means that the microbes, you have enough health promoting microbes, and you've knocked back the disease causing microbes, parasites, well enough. But then maybe 6 months to a year later, you might notice that you're waking up a little bit more, like at 3 o'clock in the morning. Or you might find that you just don't have as much energy. You're just more tired all the time, even when you're getting enough sleep. Or your gut, you might have gas or constipation a little bit. All of those signs, or you're feeling a little bit more depressed, foggy head, allergies, all of these are the warning signs that we should have paid attention to early on, telling us that we're out of balance and that we need to really treat then, so that we never end up with chronic disease. And so depending on your exposure to parasites, maybe for some of us, we need to treat twice a year or 3 times a year because we're really with a lot of animals. Maybe we're on a farm, maybe we're working in the soil a lot. Wherever, it just depends on our exposure. It depends on also our lifestyle. So this is where, if we're sleep deprived, then our immune system is going to deal with the parasites as well. If we're eating tons of carbohydrates, that's going to really feed the parasites, and that's going to make them more active and reproduce more quickly and make us feel sick sooner. So this is where, staying active, getting enough sleep, all of the healthy lifestyle practices and just, moderate amounts of carbohydrates, whole grain, avoid the processed carbs. Don't load up on carbs. It's not healthy. Just having moderate amounts, and just not going back to the old diet, but we can have a well-balanced diet where we can incorporate carbs, but nutritious whole grain carbs and whole food carbs. It's not just grains that have carbohydrates. All right, looking at the time here. Can parasites, did that one. Can parasites be passed down from me to my children or to my spouse? Yes, they certainly can. So Dr. Klinghardt shared a really profound quote where he said that the microbes that we inherit from our parents, they impact our health far more than the genes we inherit from our parents, because we inherit genetic material, but there are so many factors that affect which genes are expressed, which genes are turned on or active, and which ones are not. And its microbes really play a big role in which genes are turned on, which genes are active. So that's really important. And the microbes that are living in the digestive tract of the mother, the microbes that live in the birth canal of the mom come from the digestive tract of the mother and the father. All right, so the microbes that live in the birth canal of the mother, they're coming from the digestive tract, from the intestines of the father and of the mother. So that's how so if a child is born through the birth canal, they will pick up microbes that originally came from the mom and the dad. And yes, we can pass parasites to our spouse. So that's why our students that are recovering from chronic disease, their spouse will also be energy tested. If their spouse isn't really sick, doesn't have chronic disease, maybe they just have some digestive issues. We all have parasites. You can't live on planet Earth for any length of time and not have parasites. Maybe a brand newborn, depending what they get from their parents. But it's the degree of parasites that we have, right? So if both spouses have chronic diseases, then it would be really wise to be treating both of them. All right, so my family and doctor think I'm crazy for thinking that MS is caused by parasites. How can I convince them? Share the event that I did last week, why Pam thinks that parasites cause multiple sclerosis. There's a lot of evidence there. There's a mountain of evidence there. And it was really neat. One of my students shared that he shared my video, and I don't know about the blog post, but the video for sure, with his family last weekend, and they were really amazed. So there's a lot of good information there that will help them to see the evidence that MS is an infectious disease caused by parasitic infestation. All right, I will go to some questions over here. Hello, Jacqueline. Your son has progressive multiple sclerosis, 36 years old. He wants to start your diet and join the masterclass to get started. He would like to speak with you. How can that happen? So when he watches my masterclass training, at the very end, he's able to fill out a form, and then he'll be able to book a time to chat with me. So he can watch my masterclass training, and then at the end, he'll see that there's a link he can click on, fill out the form, give me enough information so that I have enough so I can really get to know a little bit about his health history, what he's been through, where he's at. And then from there, he has to hit submit. He sends off the form. He's going to get an email from us, a congratulations email, that he can book a time in my calendar. Make sure he also watches the coach-a-thon, because the masterclass training introduces him to some of the common parasites that impact multiple sclerosis. And then from there, when he books a time with me, before we meet, if he watches the coach-a-thon, then he's really I walk him through all the steps in the academy, how the academy works, so that he'll understand. And then when we meet, he'll have really good questions for me, right? Some people just listen to the coach-a-thon and they join, but they still book a time with me, because every student that I work with, I want to make that personal connection with them. I want to get them off to a really good start. I'm so excited. I can't wait to meet him. Jacqueline. Barry, will ivermectin help remove parasites? So ivermectin will help remove specific parasites, not all parasites. Some roundworms, like even people that have rosacea can be helped. Different types, like you can just look it up. Look up ivermectin, the types of parasites it treats, and you'll see. So it is not a magic cure for multiple sclerosis. It really is not. It's not going to be a magic cure for any type of disease. There is one parasite drug, for example, fenbendazole, that has been reported to be really helpful to treat certain cancers, but not all cancers. That's the same thing with all these parasite drugs. So there are certain cancers that are treated well with albendazole. Also, other cancers are treated well with, I believe it's Alinea. So I did a live event on this one too. You can look on livediseasefree.com. Again, under the blog post, you'll see that, cancer causes parasites, and go through that, because I share a whole bunch, like virtually all, even ivermectin will treat certain cancers. So it's just so interesting. And this has been known for many, many years. This is not new research. It's just there's this growing interest, and now they're going, oh, ivermectin could be a promising new treatment for cancer, or Alinea could be a promising new treatment. And they've had this research for decades. It's just ridiculous. So ivermectin will remove parasites, but again, like in our experience working with hundreds of students, if people are really disabled and they just take the parasite drugs that they test well for, they don't recover as well. The parasites are not removed as well unless they're using also the oxidizing, and I can't say the name of it. You can, again, go to our website and you can do a Google search of Live Disease Free and using oxygen to treat parasites, and you'll find that blog post there, and I talk about it. So that's a really helpful thing, that oxidizing agent. We can take it orally and through enemas, but when we're ready to treat. So once we follow the diet, we're supporting the body, we're feeling a lot better, then we start to use a combination of parasite drugs, oxidizing agents, oxygen therapies, and herbs. So those three things. So will ivermectin remove parasites? Only specific ones which you may or may not have, Barry. Mike, could the parasite C. perfringens bacteria be responsible for MS? I don't believe so. There are several bacteria that could be involved. So with multiple sclerosis, it's a condition of dysbiosis. We're really out of balance. And so our students that have MS, they generally pass a lot of very large worms. So sometimes it's roundworms, but sometimes it's also flukes, and flukes can cause a lot of inflammation. So these larger worms, they infect us with smaller bacteria. So we can have these bacterial infections because of the larger worms. So and there's Clostridia, or maybe that was Clostridia, the C. Maybe that's a type of Clostridia that you're talking about. But yes, Clostridia has been linked with multiple sclerosis, but so have tapeworms, so have flukes, so have filarial worms. I share all of that on my masterclass training. And also malaria, or a Babesia malaria. That's really, there's like 100 years of research on that, where they were treating people with quinine many years ago and having huge recoveries. Also and it's not the same for every person, unfortunately. And then also Borrelia, which causes Lyme disease. Unless I can't find it, but the MS Society, they had a whole page on MS and Lyme disease, and they took that down. But I did take a screenshot, and you can find it if you go to the Wayback Machine. But they were talking about how, with multiple sclerosis and Lyme disease, they have very similar symptoms. And they have very similar MRI test results and lumbar puncture test results. So like the results are similar, almost identical. The symptoms are similar, almost identical, but they're not the same. Why? Because if you have Lyme disease and you treat it early enough, that will respond to antibiotics. But if you have MS and you take antibiotics, people are not helped by that. But that's not true either, because the MS Society has even funded research showing that treating multiple sclerosis early enough with antibiotics, it can be helpful. It's not curing people, but they notice significant improvements. And that was funded by the very group that said that that's not the case. So they took that down, I guess, because it's very confusing. They don't have their story straight. But you can still find it if you use the Wayback Machine. You can find that. So could that bacteria be involved? Yes, it certainly could. But in my humble opinion, it's not going to be just that bacteria from all the people we've worked with. And if you don't treat from big to small, then you keep getting reinfected with the small parasites. Veronica, You do meridian testing. Oh, good. So you said I'm doing meridian testing with a naturopath. I've done 7 rounds of combining multiple prescriptions at high doses, and I'm still dealing with fatigue off and on. So I don't know, have you had some symptom improvements? Have you gotten rid of all of your symptoms except for fatigue? Or did you only just have fatigue? So you just have to let me know that. And so this is where it's not just the parasite drugs. And so in the Live Disease Free Academy, the Live Disease Free Plan, we're definitely, once we have some of the parasites down in our body, we've decreased their population, decreased their presence, then we are working on other things. So we are definitely making sure that we're not dealing with heavy metals. We're building back the good microbes. We're building activity. We're doing liver gallbladder flushes. So there's all kinds of other things that need to be done too, not just killing the parasites. And this is where you need somebody who has, maybe there's still something that hasn't been treated well enough. So maybe she can pick that up or not. I don't know. Sometimes there's still residual fungal infections. It could be some smaller protozoa or bacteria. It could be something smaller like that if you're not passing any more larger parasites that are visual. So I would need more information. Oh, here we go. The residual numbness in my fingertips that won't budge. So there's a certain scan looking at your blood intestinal flukes despite several doses of praziquantel and albendazole. What am I missing? So if you still have intestinal flukes, they are really difficult to get rid of. We use, again, a combination of I can't say the names of the drugs here because then people are going to go, well, Pam said this, this, and this. But so albendazole and praziquantel are helpful, but you should test well for other parasite drugs that you could mix together with that. Also using the oxidizing agent would be really helpful. And there is another drug that I can't remember what the name of it is that might be more helpful for treating intestinal flukes. You'll have to do a little bit of digging. But intestinal flukes all of them are difficult to treat, to recover from. So I don't know how long you're doing a treatment cycle. That's another thing too. So these are all factors, like how long, the combination of the drugs, regularly. You can't let off on them, using a combination of treatments, herbs and the oxidizing agent and the treatments. But intestinal flukes are difficult, but so are roundworms to totally clear, and it does take multiple cycles. All right. And hopefully, I don't know if you've been using the oxidizing agent, but that you can actually see them. Is that how you know that that's what you're dealing with? The bacteria that may trigger multiple sclerosis. Yes, I've done a talk on that already, Mike. And whenever they say, one specific parasite, I'm really skeptical because in our opinion, we've never found it that it's just one. For example, for people that have Lyme disease and they work with Lyme litter doctors and they just take antibiotics and they're treating Lyme, they have tons around, big worms. And until they start treating those ones, they find that they just don't get better from antibiotics. So I would just be really cautious because treating, Clostridia with antibiotics, you'll probably find, or somebody would just focusing on that, they'll find they're worse off after using a lot of antibiotics. Because for people like myself, the reason I got sick with parasites is because I was on a lot of antibiotics. So in our recovery, we don't really use antibiotics. We use herbs and liposomal herbs, which will go deeper into our tissue, but we prefer that versus antibiotics. I'm open to it if for some reason it could prove to be a better, more effective way of treating in the future, but I just haven't seen it yet in people that have taken a lot of antibiotics working with other practitioners. What do you know about killing parasites using the Rife machine, low energy electromagnetic waves? You can use the Rife machine and it could possibly be helpful for bacteria and protists, but we just haven't seen that it's effective enough on its own. So it could be a complementary therapy that you could use. But again, it's on its own, it just is not going to be enough. I haven't seen it, and I've known about it for many, many years. I wish that it would be. Tanya, what about HIV-1? So with the different types of viruses, uh, what we have noticed is that if you really work on all the steps in the Live Disease-Free plan, where you're really working at correcting your microbiome and building a healthy lifestyle and just going through all the steps there, then a lot of these different types of viruses, whether it's HIV or hepatitis, they kind of go into remission. They're kind of quiet. And so that's what I would really advise, is that we don't really focus. I mean, there are natural things you can do that are antiviral. Uh, and actually, even the oxidizing agent that we use is really antiviral, and it's non-specific. It will treat all kinds of viruses. So I would just do all of those things and not take the prognosis that our doctors say, like, oh, you're going to be disabled, you're done, there's no hope for you. It's like, no, like, your body is amazing. It's been designed by, I believe, by God, and it is so incredibly adaptive to healing. So if you just do all the right things to support it, you may find that different viruses are going to be just quiet and you're considered to be in remission. Can the favorite oxidizer, whose name cannot be mentioned, can it cure parasites alone? I wish. No. So ozone is great, but ozone is quite expensive. And that other oxidizing agent, again, you can find it on our website, or just do a Google search of Live Disease-Free and oxygen therapies to treat oxygen therapies to treat parasites. You'll find it there. I wish it was enough. So the problem is you can take it orally, so you'll really increase the oxygen in your blood, and that will impact some of the parasites in your intestines. You can do enemas, so you can reach the large intestine, but you can't reach the small intestine well enough, and you can't reach the central nervous system with strong enough oxygen to kill all the parasites off there either. So that is why it is helpful. It is really helpful in conjunction with the other treatments, but on its own, it's not enough. I wish it was, but it's not. Juanita, you're going to Cleveland Clinic in Ohio, US. You may have undiagnosed parasites. Tired, any advice? Seeing neurologist, gastroenterologist, and infectious disease doctor. So you can go down that path, but you're going to be very frustrated because they're not going to find the answer. So some people can spend years and years going from doctor to doctor trying to get a diagnosis. Eventually you'll get a diagnosis, but it's not going to make you happy, because then it'll be like, well, now I've got this disease and now there's no cure for it, and now I've got to take immunosuppressive drugs for it. Or Juanita, what you can do is you can learn how to be the director of your health, and you can learn how to play a really active role in treating these parasites, and not just treating the parasites, but also building a healthy lifestyle and learning how to just support the body, support the immune system, how to live in this world where there are certain environmental toxins that we don't even know about that are really impacting our health, and how to kind of maneuver around them to protect our body, our health, the health of our families, the health of our loved ones. So if you do go down that path of seeing neurologists and gastro, it's going to be a long, painful, frustrating road. Even the gastroenterologist, what's so frustrating is that in Canada, like the gastroenterologists, like if you were on a parasite drugs, they would be looking at you like you just did the worst thing. But then if you look on some of these larger sites, these medical groups and gastroenterology groups, and they talk about parasite symptoms. Like I did a talk on that also. And so they're saying that all the symptoms you're dealing with are caused by parasites. But then you go to your doctor and say, well, the Cleveland Clinic, or all these different gastroenterologists, like big groups, they're saying that all my symptoms, that like the bladder issues, the cognitive issues, the pain, the weakness, all of this balance issues, spasticity, can be caused by parasites. So doctor, could I have parasites? And they'll say, have you traveled recently? Well, no, I haven't. Why would you think you have parasites then? And then they'll do a stool test and nothing's going to show, and then that'll be the end of it. So you will go from doctor to doctor, and sometimes they'll tell you it's in your head. They do that very often. It's like you need to go see a counselor or a psychiatrist, and that's really insulting. Hi, Jake. Have you worked with anyone that has lost a lot of sensory? Yes, taste, smell, sense of temperature, even a sensation of sleep. Absolutely. And I don't know if you like what you're dealing with, if that has to do with that last condition, disease, virus that was going around over the last couple of years, or if it's a condition that you're dealing with. But absolutely, yes, there are a lot of things you can do to probably totally reverse that. But you have to have the right things. And I can't even talk about what some of those things would be here because we would be completely censored. Bernie, do you see a correlation between the COVID-19 vaccine and parasite growth? With the students I work with, they usually were sick well before COVID. So they had chronic disease before. And when you have a lot of parasites and you get something like COVID, you can feel way, way worse. It can really hit you a lot harder. And that's a loaded question, Bernie. I know that I did follow a lot of the doctors throughout that whole time period, and there were all kinds of things in the vials of the vaccines when they looked at them under the microscope that it looks like there definitely was a lot of contamination in a lot of the vials that should not have been there, which could potentially have also included parasites. So, but one thing is for sure that the chronic inflammation state that either the persistent COVID or the vaccines would cause in our body, that chronic inflammation that you're dealing with or that a person would be dealing with would definitely make them weaker and more susceptible to the parasites that are living in them to becoming more abundant and becoming stronger. And if they're exposed to parasites, their immune system is overwhelmed. Like your immune system is overwhelmed dealing with the spike protein and with the virus. So Anita, where do we find doctors who aren't testing and dismissing patients who have symptoms but negative parasite tests? You're just near quitting. It's like I would really encourage you not to give up, right? Just don't give up. But that's what we do in the Live Disease-Free plan is we will help you to access the treatments, access any practitioners that you need. The nice thing is you'll be able to do a lot of it yourself. It's kind of like deworming your dog or your cat or your horse. It's not difficult. It's very safe when you know how to do it. It's a skill that you really need to learn yourself because we're going into some very uncertain times. I'm sure many of you feel it. I mean, it's been uncertain for the last 3 or 4 years. We've gone through some really crazy times, and it looks like there's some crazy times up ahead for us. So what I believe is that it's really important that we restore our health as soon as possible so that we're strong and that we can weather these storms together, and that we also know what we need. So let's say if there is another virus pandemic that comes out, that we're equipped so we know what to do to protect ourselves, to keep ourselves out of the hospital. So that's a really important thing also. All right. So Juanita, you can either continue to go to these experts and be frustrated and just disheartened, or you can just take charge of your health and recover. Katie, have you experienced good results with fenbendazole? Most of our students don't use fenbendazole, so that is a parasite drug more for roundworms, I believe. It has been used for animals, and I know that there was one gentleman who used it for treating a specific kind of cancer. It won't treat all cancers, but a specific kind of cancer. But our students don't really test well for that one as much as other parasite drugs. And these are people that have, I usually have students that have either multiple sclerosis or ALS or PLS or Parkinson's disease, or they've had cancer, or they have the symptoms, neurological symptoms. They don't have a diagnosis yet, but they have a lot of neurological symptoms heading down towards neurodegenerative diseases. And it's not, I mean, there have been a couple of students that have tested well for it, but again, they would be using it in conjunction with probably about at least 4 other drugs, like 3 to 5 drugs at one time, that and it's not going to be an end all be all cure. You're very welcome, Katie. Veronica, can back-to-back colonics be helpful? Well, the parasites are holding on. They're not going, and the colonic is only going to reach the large intestine. So you could talk to your practitioner or the technician that's doing the colonic, and you can ask them if they would add in an oxygen. I heard from one of our students that, I can't remember, it was like a little bit of hydrogen, food grade hydrogen peroxide that the colonic technician was adding in, but also the oxidizing agent that we use, they could potentially add that in, or maybe they would want you to add it in, like you can pour it in, they'll tell you, like you'll know how much to use, but that can help because it's the oxygen that kills the parasites. Just water they're not going to come out unless they're dead, right? They hang on. They want to stay there. You're very welcome, Jared. Hi, Bernie. Let's see if there's any other quick questions there. Okay, 2 more questions here. Can parasites cause cancer? Yes, I have a whole talk on that. I did that maybe 3 or 4 weeks ago on livediseasefree.com. You can also find our videos on YouTube and on Facebook and on Rumble. And on Rumble, they'll be shorter. Like I just edit them. We have them edited. So will I have to go off of my medications when I treat parasites, or can I do both? No, you can do both, but we definitely do check with pharmacists to make sure that that works, right? Because the pharmacist will know if there are any interactions between different drugs, whether it's even herbs, antimicrobial herbs. Will treating parasites make my lesions disappear? So lesions are pockets of inflammation, pockets of, I believe, that microbes infection. And when you're using the right treatments, we have had students where their lesions have healed over, but it takes time. It takes multiple treatment cycles, but we don't really focus on that, because if somebody still has a few lesions, but they're not active, and the person is completely symptom-free and has been for years, we don't really worry about it, because there's a lot of people that are over 50 that have lesions that don't have MS. People that have Crohn's disease could have lesions. People that have autism people that have migraines have lesions. There are a lot of different people that have lesions, and it's really like, how do you feel? Like, are you treating your microbiome well enough that you feel amazing, that you have energy, that you sleep well, that you feel positive and you feel happy? Like, all those things are super important, and that reflects on how your microbiome is also. All right, and last one here. I've been sick for 18 years. I have numbness and terrible neuropathic pain, and I'm in a wheelchair. Is it too late for me to treat the parasites and have hope of recovery? So I cannot make any promises to anyone, but what I can say is that the sooner you start treating the parasites, the easier it is to treat them, to recover, and the more recovery you will have. So, like, what I always ask people, first of all, is like, if you're in a wheelchair, can you still wiggle your toes? Can you move? Do you have any ability to move your feet or your toes at all? And if they say yes, I say that's a really good sign. It's not that if you can't move that you never will. What we have seen in our students is that we can have a lot more recovery than we ever thought possible. So I've had some people where their hand is clenched, and it's been clenched for like 40 years, 40. And then one morning they wake up and their hand has opened, and then they can start working it a little bit, and then they do physio. And is it like 100% better? No, but they can use it for all kinds of things. So I'm a hopeless optimist, and I really believe that the body is absolutely amazing, that it can heal itself. And I have observed in hundreds of students, is when you do the right things, when you treat the parasites effectively, that you will have more improvements than you ever thought possible, more recovery than you ever thought possible. This is going to greatly improve your quality of life. People are able to get off their medications, their pain goes away. A lot of people, it might take you 12 treatment cycles before you can start standing out of the wheelchair. But then we've had other people that, just by the diet, diet and starting to support the body, and they can start standing again. So I would just do whatever I can. And what I'm going to leave you with is, somebody said, if I can't afford to treat parasites, I'm barely getting by, what can I do? Number one, change your diet. The Live Disease-Free Diet Guidelines are on our website under research in the main menu. That's the first step, is to change your diet, decrease the carbs low enough that you start to feel a lot better. You can learn about the oxidizing agent, right? That is dirt cheap. You can get your hands on that. There are certain herbs you can get in the health food store. Maybe you can't do everything in 1 month, but you can definitely do the diet. You can definitely, and the herbs are not going to cure you, but they're going to probably make you feel a lot better, especially if you've done the diet part first. And then the oxidizing agent also. So those are things that are really cost effective to get you started, to get your belief system up. And then what I would do is I would really look for help. Like, go to church communities, go do a GoFundMe. We've had people do GoFundMes, church communities, family members that will help them to get the support they need to treat the parasites. And for anyone that, like, if you're going through all of my work, you're listening to the masterclass training, you understand all the steps you need to do, and you're like, that's great, Pam, but I don't have a doctor that knows how to treat parasites. I don't have a doctor that is going to support me. Then make sure to reach out to me, because in the Live Disease-Free plan, in the Live Disease-Free Academy, that's what we help people do. I walk them through step by step. I'm helping them to find, and this is many different countries all over the world. This is the job that I have. So you can do a lot of it yourself. And again, you'll have this skill for the rest of your life. This is truly the most cost-effective way to recover from a disease, to recover from parasites. And then in the future, you can really manage the microbes that live in your body, because you're paying attention, you knock them back periodically, you're building back the good microbes all the time, and you will virtually never need to see doctors or naturopaths at all. Sure, get some tests done if you ever need to. If you get in a car accident, they're wonderful. They'll put you back together, but it will greatly decrease your medical costs. You won't need a ton of supplements either. The supplements, honestly, most of them are expensive urine, as the doctors would say. And so the testing, you don't need in my humble opinion, you don't need $6,000 to $10,000 on testing, because it just is not going to give you enough meaningful information. So the sooner that you get ready to treat, then that is what you need to do. And that can be done streamlined and very cost effectively. All right, so we've gone an hour, so I'm just going to let you guys go. So I hope that you found, I didn't get through all the questions, but we'll do that on another time. But I really hope that you found this helpful, and I hope that you understand that parasites are causing the horrible disease or disease symptoms you're dealing with, and that if you want to have the highest quality of life, you really need to treat them effectively, and you need to learn the skill yourself. You can always work with doctors in the future, but you need to, again, play an active role in your healthcare, be the director of your health. That's what wellness champions do, and that is how I have been able to live 35 years free of multiple sclerosis, and I'm a very busy early 60s years old, and just really thoroughly thankful to God for this incredible wisdom that He's bestowed upon us, because if I wouldn't have had this wisdom, I don't know if I would be alive today. I had really bad MS attacks, very, very significant, and I'm just so grateful. So with that, get the help you need. Make sure to reach out to us if you need help. Watch my masterclass training, book a time, see if it's a good fit for you. Otherwise, if you enjoy these talks that I do, all the research I've done for you, what you can do to help me is to share, like, and subscribe. It really helps to get the word out and gets people talking about parasites. So I hope you have a wonderful week. Take care and bye-bye for now.